If you're ready to unlock more better days, to take control of your health, to push past your limits and unleash your full potential, then you're in the right place. I'm your host, Dr. Jeremy Bettle. For over 2 decades, I've worked with elite athletes and high performers, helping them optimize their bodies, strengthen their minds, and recover from setbacks. Now I'm bringing that expertise to you through the Vitality Collective podcast. In each episode, we'll dive deep into the science, strategies, and real-world solutions you can apply right away. Whether it's enhancing your physical performance, avoiding or recovering from injury, sharpening your mental edge, or simply feeling your best every single day. With insights from top experts and thought leaders, this podcast is designed to help you take action, feel better, and live the life that you deserve. Welcome to the Vitality Collective podcast, where every day is vital.
Welcome back to the Vitality Collective podcast. Today we have an incredible conversation with Dr. Heidi Millard, the founder of Longevity Santa Barbara, a groundbreaking medical practice dedicated to helping patients live longer, healthier, and more fulfilling lives through advanced screening tools. In this episode, we'll explore how whole body MRI and other diagnostic tools are changing the landscape of medicine, why strength training is essential for longevity, and how individualized health strategies can drastically improve your quality of life. If you're looking to take control of your health with cutting-edge screening and prevention, this is an episode you won't want to miss. Okay, welcome back to the Vitality Collective podcast. I'm here with my very special guest, Dr. Heidi Millard.
Yeah.
Dr. Millard, welcome.
Thank you so much for having me. Jeremy, you and Michelle, I am just huge fans of yours. I think you guys are doing some really, really great things. So anytime we get to talk and collaborate, I just learn so much from you guys. I think it's a great community you guys have built, and I just love that I get to be a part of it too. So thanks for having me.
Thank you so much for that. That's kind of you to say, because we feel the same.
Oh, good. It's great.
Well, I'd love for our listeners to understand a little bit more about your background and where you've come from and how you've arrived at where you are with Longevity Santa Barbara.
Yeah. So Longevity Santa Barbara, it's kind of a long journey to get here, right? Because it's very non-traditional medicine. My background is in family medicine. My dad actually was in family medicine. My parents were both physicians, actually. So growing up, I kind of was around their office. It was kind of modeled to me of that is what medicine is, kind of that longitudinal care of a patient and really kind of like their whole family. So it was really kind of nice. It was very natural for me when I decided I wanted to go into medicine, that's also what I wanted to do, right? To stay with families, stay with that kind of long-term care with people. Mm-hmm. So I just really naturally loved interacting with people, being able to walk into a room and having someone tell you very intimate stories of their life and be very vulnerable with you. I just loved that from the very, very beginning, right? So my background a little bit, I had a few different jobs. My husband is also in medicine, so we moved around a little bit for different training purposes. And that was phenomenal for me because I got right out of residency a few different experiences of different jobs where I got to work in, right? So right after my training, I worked for UC Riverside School of Medicine, where I got to teach medical students. So like very early on, first and second years. And that was probably one of the first ways I started learning how to break down complex medical information into really digestible, easy to understand terms, right? And that's been so applicable for me to patients, right? Because it's kind of the same thing. Like, how do you take this hard concept and make it easy for people to understand? After that, I worked for a residency program. That was really fun. And then after that, I worked for 2 tech startup companies who were doing like really innovative things like whole body MRI, microbiome testing, metabolomics, all these kind of things that we got a lot of experience in learning really this preventative care model, this proactive medical care. And I was like, this is it. This is what I want to be doing, because it kind of is where 2 things meet, right? Where patients who are motivated to learn about their health meets really proactive technologies. And I was just astounded to see how much, when people understand their health, how much they actually want to change. You know what I mean? They actually want to improve things. It's much different than saying like, hey, you need to do this. We should up this medication, rather than like, here's your image and here's what this showed. And this is why this plan is specific to you. Well, all of a sudden, when somebody understands that, they're just hugely motivated. And I was like, well, this is what I want to do for the rest of my life, is to be able to have people understand their health on a really deep level that motivates them forever.
Yeah.
So that's how I came to Longevity Santa Barbara. That's how I decided that this is what I want to do. And I'm really passionate about it, as you can tell.
Yeah, you can. And right from the start, I think we really resonated over that as we got to know one another. And it really mirrored my journey in sport. I think I saw something very similar to traditional medicine in sport, whereby we would wait for the athlete to get injured and then rehab them. And you would expect a certain number, almost predict and sort of see it as inevitable. You'd have a certain number of injuries. And it just never quite sat right with me, right? Like, why are we waiting? And so we did a similar sort of thing. Like, okay, if we're going to use these criteria to pass an athlete from rehab, how many of our healthy athletes could pass those same criteria?
What
right. And so we,
it seems basic, but probably nobody was doing that, right?
Absolutely not. Like we were in the process of building out these beautiful rehab programs. And they were lovely for, the athlete that had got hurt, right? And we were going to know exactly when they could return to play. And in that process was when I was thinking, could the healthy athletes actually do this? And so we moved them to the other side of the injury. And that concept that the Navy SEALs called this left of bang, right? They got really good at getting blown up in Iraq and cleaning everything up and saving lives. But how could they stop getting blown up? Right? They weren't so good at that, right? And so we really employed that technique, and we found about half of our athletes couldn't pass those same criteria.
Yeah, and those they were going to be injured, right?
Yes, we knew that they were going to be susceptible to injury. And we knew that because the athletes who returned from rehab too early got injured, right? And so I think that those parallels into the medical world are they're there for all to see. We know sort of these criteria of what the disease states look like. And so if we know the risk factors and the criteria, can we measure them early?
Yes.
Yes, meaning the answer.
That's a perfect example of what proactive health really is, right? I mean, the definition of the word proactive itself is to take control of a situation rather than waiting for its effects to take, and then to take action. Okay. So that's really kind of what I want to do for people, right? So in my practice, what I do first is I listen to them, right? So tell me all about your background, tell me all about your family history, what your personal struggles have been. And then I want you to be proactive and say, well, here are the options, what we can do to be proactive. Some people want to go all in and do everything, right? And I'm here for that. Other people want to know the options. So we can create a personalized plan for, well, based on what you've told me, here are the things I recommend for you to do to be one step ahead of the game, right? To ever from having some of these effects like heart disease, cancer, things like that, and detect them at the earliest stages. And to really empower people to use that information to live long, healthy, like their best lives, right? That's my goal for my practice. Yeah.
I think that you've touched on a couple of really important factors there for what proactive medicine is. Yes, it's early, right? Yes, it's take control of the situation and put the interventions in place, but it's also that it's personalized.
Yeah.
It's so important that two people have arrived at the same place in very different ways. And the treatment plan for an individual will be very different, between two individuals with the same condition. And taking into account, your story about listening, right? What is their background? How are they coming to you with their beliefs about medicine and all these factors? How busy are they? Right? You've got these executives, they've got 5 minutes for you for this intervention. And then you've got other people who have got hours in a day to do it. Those two people, they need to get to the same place, but they're going to do it in very different ways, right?
Yeah. That's exactly right. In medicine, there's a term for this, right? It's called your pre-test probability for developing certain conditions, right? So taking their past history and then using imaging to determine, well, what is someone's pre-test probability of having a condition, right? So then it determines which testing is going to be best for you, like which labs, which imaging, you know what I mean? If you have like a high risk of or high rate of cancer within your family, then of course you should be treated differently than somebody who, has no cancer, but a lot of heart disease in their family. You know what I mean? So I think that personalization is key, and really helps us determine what's going to be the plan and the frequency with which we're following them up, with some of these tests,
Yeah, I love that notion as well, that we often do a screening. People will go to one of these big hospital centers and do their executive physical. And it's like, okay, here's your 100-page report. See you in 2 years.
Yeah.
Right. How are we thinking about monitoring after that? Right. This is a timestamp ultimately.
Yes.
Right. And the body is such a dynamic thing with all these different systems that adapt at different rates. So I think it's really interesting, that notion of then how do we monitor, right? I love that.
Yeah.
How frequently do we need to recheck these things based on the individual?
Yeah. So all of it is personalized. The treatment is personalized. The follow-up is personalized.
Mm-hmm.
And who you are now might be different than who you are in 3 years. You know what I mean? Or, it's kind of like a continual assessment of what's going to be best for you personally and your goals.
Mm-hmm.
So I think that's cool.
Yeah. It's just such a, we could just go down this personalization route for the next hour. That would be a really easy conversation. But I want to talk a bit more about, because we're seeing, I think we're really on the wave of this next evolution of healthcare, beyond just medicine, but really looking more holistically into how do we create interventions in some of this. And with that, we've seen the rise of these sort of private health centers that have come up, private MRI centers, private imaging centers. Can you speak a little bit to the importance here? And where I'm going with this is the people who are involved. What we see is we've got this lovely new facility. We've got a beautiful MRI machine with these lovely soft LED lights, all these pastel colors. It looks great. And people sort of think that that's the thing.
Yeah.
Right, the latest MRI machine. Can you speak a little bit to that? What happens after the scan?
Yeah, so this is a pretty complex question, really, right? So, because part of it is, what is the quality of care and imaging that you're going to be getting, which is the biggest question, right? So there's a lot of these new imaging centers opening because there's a big desire for this kind of testing, right? So people are starting to understand what the testing is. They're learning about it. They want to get it done. So basically, the most important thing is, what is the quality of the imaging test itself? What is the quality of the people who are interpreting my scan, right? So not, like, who are the radiologists that are reading my report? You know what I mean? Like, where were they trained? Are they, did they have a background in reading specialized testing? And if there's a complication, can they consult with one another? You know what I mean? Rather than just like a one-off person who maybe is reading these scans for extra cash inflow or something, So that's part of it. And then also probably the most important thing is who's then relaying that information to you and making specific recommendations. Because a lot of this testing is very complex. You know what I mean? If you sign up saying, I want the whole package, and then all you get is a 100-page printout of like, here you go, take this back to your primary doctor. That's going to be incredibly stressful, not only on you and your primary doctor, but also, are you really going to understand what needs to be done next? You know what I mean? So I think it really needs to be a comprehensive, like, I trust the machinery that I'm doing my scan on. I trust the people who are reading it. And I most trust that the person who's relaying this information to me is going to communicate what needs to be done next. What are the important things and what are the things that maybe I don't need to worry about, and who's my team that's going to be following up with me, right? Do I need a specialist? How does my primary care doctor be involved in this? And I think that that's the important thing, is that it's the whole thing rather than, who's going to get me in the soonest, or who has the newest, fanciest building, or who, the big names, who are supporting it. it's kind of all of that. So I encourage people to kind of do their homework of who's going to be doing these things and making sure that someone's going to be kind of a guide on this process, than just kind of giving you medical data without actually any kind of follow-up plan, especially if it's not going to be personalized.
Yeah. I think first and foremost, that's why we wanted to work with you, as a part of the Vitality Collective. Something I've told practitioners over the years in sport is that very, very rarely will you be challenged by how much you know in your career. How you interface with people and cause a behavior change is what will make you an elite practitioner. It's not what you know. That's entry level. We hope you are a good doctor. Right? We hope you know enough, right?
Just the basic expectation.
Yeah. But what we're talking about here, like this is not a simple blood test to check your cholesterol. We're not looking for that stuff with whole body MRI, with some of these diagnostic imaging techniques. We're looking for the big stuff, right? We're looking for cancer. How somebody interfaces with you over that information, this is a stressful period of your life when you're checking for cancer. Like, you want that relayed to you in the most compassionate way possible.
Yeah.
And that's something that we've come across, in terms of objection to having this sort of testing done, is people are terrified of finding out, right? It's almost like if I don't know, if I don't do the test, it's not there.
Yeah.
How do you deal with that? Because it's terrifying, right? To go through this.
It is. And I think that just the first thing is picking that guide who is going to be compassionate about things, not even just compassionate about telling the bad results, but like giving you the results as soon as they have them, because waiting around is probably the hardest part. You know what I mean? Like, I want to know what as soon as I walk out of that scanner, I want to know the results, and so if it takes 24, 48 hours or something like that, that somebody's going to communicate that to me as soon as possible. That's incredibly important as well. Or even at least being transparent. Am I not going to get results for another 2 weeks? I should probably know that before I even scan this, right? The other thing too is kind of being compassionate about where people are. I wish it was true that if we didn't check, it wasn't there. But unfortunately, that's not how it is. And I think that the most common feedback I get from people is, I wish I had done this sooner because I feel so empowered by the information of knowing, even when it's a completely normal negative test, they say, I feel just so empowered by having this information. I want to keep doing checks now because I feel like I know my medical health better than I ever have before. And there's some real peace to that, and when we do find something, almost all of the time, we find it at a very early stage when it is actionable, when we can do something to reverse any of the effects, or at least pause it from if it's, cardiac disease, we can pause progressing. If it is cancer, oftentimes we can find it at a very early stage where even just like surgery can resolve the problem and they live a fully healthy, long, normal life, And the thing about whole body MRI is the cancer that we're screening for are usually cancers that are not detected by other types of screening modalities, right? It's really good at detecting solid organ tumors, the brain, the kidney, the liver, the pancreas, the prostate, the ovaries for women. There aren't any other screening tests for this. So that's why for many people, detection usually is stage 3 or stage 4. Whole body MRI, we're often finding things. Sometimes we find things just with an enlarged lesion. It's not even a mass yet. You know what I mean? It's just like the very earliest signs. So I just really think that this is going to be the future of medicine, is to be able to have this kind of screening for people. And at first it is kind of frightening for people, but I will say that the more you become accustomed to this kind of screening, and the more you understand what we're doing, the more empowered you're going to feel about ownership of your health, rather than just waiting for something to happen and then reacting to it, taking your health in your own hands and having that knowledge is a huge amount of peace.
Yeah, I think the area that I'd really like to emphasize there is catching these conditions early.
Yeah.
I think the power of catching cancer in its earliest stages, maybe a 0 or stage 1,
Yeah.
versus when you get onset of symptoms. Can you speak to some of the differences in what an experience would be if you were able to capture that early versus when you were symptomatic?
It's just a huge amount of difference, right? So, if you think about some of these cancers, like pancreatic cancer, we all think of that as kind of like a death sentence, right? Because I don't know what percent, but I would say probably 90% of pancreatic cancer is found when someone has symptoms, which is already stage 4, right? So there are no screening tests. There are no problems. It's usually when people have like really severe side effects that we're detecting this. And so by that point, most of the care is like essentially palliative care, right? So there's not going to be any life-saving effects by that point because it has already spread. But I have seen people, with this technology finding a small mass in the pancreas, and they say, we don't know what it is, but we recommend you have it surgically removed. They have it surgically removed. It turns out to be pancreatic cancer. It was found, I don't know if it was considered stage 1 or stage 2, but they went through, I think, like just 1 stage of chemotherapy after that. Now they're just on very, very close monitoring, and they're going to live the rest of their life. So I'm talking not just a small change, but potentially your life, you know what I mean? It could potentially save. So, there are really no other screening tests for pancreatic cancer, for brain tumors. Imaging really is the best thing to determine these. And even for women, like ovarian cancers and things like that, sadly, women are getting these cancers younger and younger, and there really is no way of detecting them until they're very late stage and cause symptoms. I'm just very encouraging for people to, if you're interested at all and you're the kind of person who feels that knowledge is power to you, and you feel like you would understand some of these tests, and you would feel empowered by knowing what your results are, I strongly, strongly encourage you to do it with a guide who's going to walk you through it, the whole process.
Yeah. Thanks so much for that. And again, the compassionate delivery there, is so important. One of the whys for us in building this service around Vitality Collective was a dear friend of ours who just passed from pancreatic cancer a year or 2 ago. And one of the most wonderful human beings you could ever meet, but it's just, as soon as that diagnosis comes in, and it's been because you reported symptoms, you sort of know where it's going. And it was just a devastating loss for us and this community. And so I think that this just speaks to that. One of the clients that we collaborated on, his wife passed from cancer, and watching him go through this screening process with you, and the weight sort of melt off his shoulders, and the moment that the power struck me was in that moment when we were looking at the image off the MRI of his pancreas, and it was all clear. And that was the very moment that I knew that we'd just built something that was going to be transformational, and so, I just, I can't emphasize it enough, just how important this early detection is, for everyone.
Yeah. I'm sorry to hear about your friend. I really think that in the future that there's going to be so much screening, and this is going to be the more time goes by, the better the scans we're getting, the faster the scans are getting, the more affordable they're getting. It's just becoming more and more accessible to this. So I think we're on the cusp of people learning about it and wanting to do it. And once you know people that have done it, it becomes more normalized for you. So, so they're more likely to do it. So I just really think that this is going to be the future of things. And the more that I see it, and the more I see this, how it, like, honestly, it changes people's lives, the more I'm a believer in it. You know what I mean?
Yeah.
So it's an exciting time to be in medicine right now, if you're willing to take have an open mind about some of these alternative testing that is really doing these things, I know we personally have talked a little bit about some of the reasons why people don't want to do these tests. And maybe we could talk about that now, if that's okay. Probably some of the biggest concerns that people get is they're worried about false positives on some of these testing, And I think that that's a very real concern. Sometimes we find things on people, on their whole body MRI, on their CT scans that are what we consider abnormal findings, right? Maybe they have a cyst, they have something that we can't determine what it is.
Mhm.
So then that sometimes requires further follow-up testing, right? So the most common one is the thyroid. The thyroid gland is it's a glandular tissue, right? It's not a solid organ. So a lot of times we find things on there like a thyroid nodule or something that we can't see very well on MRI, and they recommend like an ultrasound or something to get that followed up. So it is a bit of an inconvenience, right, to have some of this like extra testing to see, is it something to be concerned about? Is it not? The vast majority of these turn out to be nothing, basically, but they do require a little bit of follow-up.
Mhm.
But that is probably one of the biggest side effects of doing whole body MRI. So I think it's really important that people, before they do this testing, that they understand that that might be part of things, that something might come up that requires further follow-up.
Yeah.
Most of the time they can differentiate between like, no, this is concerning, we need to take action on this now, versus we should probably do a repeat ultrasound or something in 3 to 6 months. It's really not that inconvenient. I think actually the fear of this, abnormal findings and requiring further follow-up is a little bit more blown up than people think. I think that that's a very small minority of people. That's a very small inconvenience when compared to the fact of like someone just told you don't have cancer that we detect, I think that that's pretty powerful. And, I think that those are really kind of small things, but you just have to know that they could happen before you do this test. But I think that they're pretty minimal, really.
And what about the merits of sort of multiple screening methodologies? You mentioned MRI being really good for sort of the solid organs. What can people do to sort of create redundancy and sort of screen for some of the areas that the MRI won't detect?
Yeah, that's a great question and that's kind of where the personalization comes in, right? So there's no test that's perfect. Every test kind of has its strength and has its weaknesses, right? So whole body MRI, like you said, is really great for for solid organ cancer screening. Type of testing or illnesses like lung cancer doesn't really show up very well on whole body MRI, right? Because lung cancer is calcified and that doesn't really show up on MRI. It shows up really well on CT, right? So sometimes, especially if someone has a family history of lung cancer or they have a personal history of smoking, or if they just want to be completely thorough, we do the whole body MRI in addition to a low dose lung CT screening. And if they have a family history of heart disease or a personal history of high cholesterol, sometimes we can also do a low dose coronary calcium score, which helps us determine what their cardiac disease risk is. Almost like all of these tests kind of build on one another to help us interpret what is your overall risk of different illnesses. And from that information, what we can do is we can compile, this is what we found. And based on where your results are, this is when I recommend a repeat, So someone who has a calcium score of 0 and their cholesterol is fantastic, well, they probably don't need another calcium score in a year. Maybe they need it in a few years from now. In a whole body MRI, let's say, based on these things we find, this is how soon you should have follow-up versus somebody else who, is your neighbor across the street that maybe needs a much more close follow-up because of their family history or their genetic findings that we've seen, So I think that those different modalities really kind of add up to be a very comprehensive type of screening, especially when you combine it with traditional screening like colonoscopy, mammogram testing, pap smear testing for women. All of these things kind of add up together because they all have their different strengths.
I think that's a really good point. I'm glad you brought up. This is not a replacement for those tests that you should be screening for on a regular basis. Your women's health screens, your prostate screening for men. Is that right?
That's absolutely right. Yeah. Because those are catered to be very sensitive to early types of cancer, right? Colonoscopy is like a really great example. That's the gold standard for colon cancer screening. Colonoscopies can detect polyps as small as like 1 or 2 millimeters in size. The MRI probably is not going to detect it until it's about 7 or 8 millimeters in size, So it's like an additive test to help determine what's going on. Kind of like skin cancer, I recommend people continue to see their dermatologist for skin cancer screening, just because realistically, skin cancer doesn't show up on a whole body MRI until, much later in the disease course. So that's why all these things add up together, in addition to not replacing those standard cancer screening recommendations.
Yeah. And likewise, I don't think that this sort of replaces your physician, right? Like, this is value added to your physician, to the screens you're doing with your physician. This is not something like, I'm going to take charge of my own care. I'm going to go do this, and this is all I'm going to do, right? Yeah. So I think that this is much more of a team approach. Our messaging is around the collective, but wider than that, this is about having people who are specialists in various areas all looking at your health.
Absolutely. I love when people's primary doctors are willing to be part of this, part of our review. So then it's a smooth transition between, here's what the follow-up care is. I recommend they have follow-up imaging at this time. Here's what I would love to have them do in the interim, and kind of work together with their primary doctor, especially if someone's had a relationship with their primary doctor. I want to work with them. You know what I mean? And almost always, even if someone's a little bit hesitant, there's someone's primary doctor is a little bit hesitant in the beginning. When they see what we do and what we offer people, all of them are on board, because they actually see the value of this, and they see how the collective approach basically really adds for the patient's benefit, and the patient themselves is only more educated, more motivated, and just does a better job in general at doing all of these things and being very proactive about their health.
Yeah. And one of the other objections that you hear about is sort of radiation with this sort of screening. Now, MRI, that's not a factor.
Yeah.
But as we start getting into CT, what are the differences there? You mentioned sort of a low radiation CT, for lung tissue, and then there's CT angiogram, which is a step up. So what are some of the differences there, and just how concerned should people be with that?
Yeah, that's a great question too. So just to emphasize again, MRI, because it uses magnets only, there's no radiation whatsoever in any kind of MRI or ultrasound technologies. So CT is a little bit different because it's almost like a very advanced X-ray machine, right? To take a look at some of these solid organs, and they're not all the same. So a lot of these tests have been catered or created, I should say, for screening purposes. So they're really looking at that one thing. And like, let's say the lungs, for lung cancer screening, they really lower the amount of radiation to be able to screen somebody for any kind of calcification. If somebody has something that shows up as abnormal, well, then they go into like the more comprehensive, what we call a diagnostic study, to further evaluate, well, what are the abnormalities in a more detailed format, But for most people, we talked a little bit about pre-test probability. That's where it's really, really valuable for people now to determine what some of those risks are. So we want to spare you as much radiation as possible while still doing a screening study, so that depending on what that shows, that will help us determine, are you somebody who, your scores are nice and low, everything looks normal, we can repeat this study in X amount of time? Or are you somebody who, this looks abnormal, we need to take a closer look. Let's do some of those diagnostic studies that might have a little bit more radiation, but it's going to be worth it now because your pretest probability is enough that we need to determine, do you have this disease present, or do you have something higher risk? You mentioned cardiac studies. That's probably one of the biggest ones that that's getting talked about right now. So there's two main tests that we kind of do: coronary calcium scores, which is kind of a very, very short CT scan looking at calcification in the heart, and then a CT angio, which is a much more invasive testing where we basically inject contrast into somebody's arteries and determine how much blockage there is. They're both really great tests, but because of radiation and risks to contrast and things like that, I almost always recommend, well, why don't we do the first study that we measure these things in something called millisieverts. That's how much radiation there is. A coronary calcium score has a millisievert of 2. The coronary angiogram, CT has 8 millisieverts. So 4 times as many, which sounds like a small difference, but it's actually a huge amount of difference. So I always counsel people, let's put you through the safest, lowest radiation testing first, determine what your probability is of having that disease. And then we can determine, are you somebody who's going to benefit from some of those higher, more invasive, higher radiation testing, rather than just exposing everybody to that higher radiation when potentially you don't even need it. But just to give you some background, a normal chest x-ray is 0.1 A dental x-ray is 0.001. A DEXA scan is less than that. Even it's less than one dental x-ray. I think the amount of radiation we get in 1 year, just from like walking on the planet Earth, just from life, I think is a 2 or a 3. So, to give you some idea of what that testing kind of means, and how much radiation exposure we want to give people, right? We want to give them the least amount as possible while still giving you the most information as possible.
Yeah. And what are the differences between what the CT angiogram and the coronary calcium score are looking for?
Oh, great question. So the calcium score, the coronary calcium score, the low radiation testing, that is purely just scanning the heart for any evidence of calcification, which is what we find in hard plaque, or what we call atherosclerosis, right? So if someone has a score of 0, that means that they have no detected calcified plaque in the arteries of their heart. So that helps us determine, is your risk high or is it low? If your risk is high, and say you have a high level of coronary calcium disease, that's when we start talking about a CT angiogram, which, as I mentioned before, we inject dye or contrast into your arteries, and we can actually see the blood flow through the arteries of the heart. So it not only tells us how much plaque or atherosclerosis you have, but also how much blockage potentially a person has. So you can see how it's kind of like a step-up test, right?
Mm-hmm.
Someone who has a calcium score of 0 probably doesn't need that other test, because they're very, very unlikely to have any level of blockage because they don't have any calcification. So that's kind of the difference between those two studies and determining what they're looking for. One is just calcification. One is actually looking at blood flow through those arteries of the heart.
Mm-hmm. Yeah, so it's unlikely that somebody could have sort of that soft plaque build all the way up to a blockage without some level of calcification.
Yes, because hard plaque and soft plaque, which you're alluding to, almost always build up in synchrony, basically, right? It's very unlikely that you have a lot of soft plaque without hard plaque, or vice versa. Right. So it's a really great test to help us determine what someone's pre-test probability is in determining what level of testing you need.
Mm-hmm. Mm-hmm. And then one of the other tests that we're familiar with and have put in place would be the Gallery blood test.
Yeah.
For cancer.
Mm-hmm.
Where does that fit into the mix of all of these different screens that we're putting in?
Yeah, so that's kind of like a totally separate test that's really quite new, right? That's kind of been approved for, I don't even know what year, but definitely within the last 5 years, maybe even the last 3 years. But it is a blood test to determine if there's any evidence of active cancer in your body. So this is than a genetic testing, which looks at your probability of ever developing cancer, right? Are you at high risk of developing cancer later in life? This is looking for active cancer cells, or it's kind of a complex thing, right? But it's looking for active cancer within your blood. And so that's just kind of another way of an additional testing to see, is there any evidence of cancer within your body at this moment?
Right. And so this would just be something else to sort of put into that almost redundancy mix, where it's going to be really strong in some areas and not in others. Yes. MRI is going to be better in some than others. I know Gallery doesn't cover brain cancers, for example, right? Which the MRI would. And so I think that there's just the sort of that cost benefit all the way around with that.
Yeah, it's just kind of putting the strengths of all of the tests together, and duplicating your chances of early detection of this.
Yeah. Okay, well, this is doing a great rundown of all of the different sort of ways that people can approach this imaging. One of the challenges we've had in moving sort of this mindset out of sport is the cost of it, right? A lot of this is not yet covered by insurance. And so the price can be a bit prohibitive for many people. Where do you think people should start? Say we don't have the resources to go for the whole body MRI just yet. Where can we go with this?
That's really such an excellent question, right? Because everybody's ability to do these testing is different. Because you're right, insurance at this point in time doesn't cover any of this testing. I think that in the future it will, when it becomes more cost effective and more affordable for people to get this testing done. The whole body MRI is just really one of the tools. But a lot of the other testing is much, much more affordable. The coronary calcium test we talked about is $249. The lung cancer CT screening is $4.99. These are much, much more affordable. Even the DEXA scan itself, which is very helpful, not in cancer detection, but in detecting bone strength, muscle mass, visceral fat levels, all of that. That's also $249. There are stepwise things we can do, even if whole body MRI is not yet in our grasp. That being said, every year that goes by, the technology is actively improving, right? So, the amount of time it takes to do these whole body MRI right now, the scan is about 45 minutes in time. But as things continue to improve, the scanner time is going to get shorter and shorter, which means a lower cost to the patient, So I wouldn't be surprised if us having this conversation again in even like 3 years, it's going to be a different conversation because it's going to be more accessible to people, not just the time, but then the cost, and the accessibility. Where this test is going to be offered is going to be more widely available. So, and I respect that, everybody kind of has their own, agenda and when they're going to be able to do this testing. And I think that knowledge is really, really helpful for understanding, well, it's a very expensive test. What exactly am I going to get out of that? Right. Yeah. And my answer to that is we're going to do this screening, but you're also going to get someone who's going to walk you through it, interpret what it is, and then show you the images. So not only are you just going to get some information, normal, abnormal, but you're actually going to fully understand and see your body in a way that probably you've never seen before. And yeah, it's hugely motivating and healing really in a lot of ways to be able to see some of these things.
Yeah. And I guess as we conclude sort of talking about this part of the imaging, what happens if it's positive? Like, where do we go from there?
Yeah. So, when is positive? And like I said before, almost always it's at a very, very early stage. The radiologists at Pueblo that we work with, that we do the whole body MRI, I love them. I think that they are fantastic. I think that they are very reliable. And I know for a fact that when they have something that is abnormal, they talk with one another, and they get kind of cross feedback of, hey, what do you think about this? And they communicate with one another, and it's reflected in the report, which I think honestly is not happening in a lot of imaging centers. So that's why I have a lot of faith in our imaging center here in Santa Barbara. So when it is abnormal, the radiologist will call me right away. Oftentimes, because sometimes even the technologist will have said, maybe the doctor needs to look at this sooner, right? So they will send a message to the radiologist. The radiologist will call me almost as soon as they see it. They'll review the images with me. They'll get that report to me. And the first thing I do is call the patient and tell them what we see. Then we kind of create a plan, right? We get their primary doctor involved. We get a team involved. We get next steps involved. They are very, very well taken care of, because the worst thing is to get bad news like that and not know what to do next. What you really need is, I know that somebody's taking care of me and planning out what the next steps are and communicating with my doctors and explaining to me what this means and what this is going to mean, in a day from now when I forget everything you said on the call, that you have somebody that's available to you. And yeah, you've said it before, who's going to be compassionate with you the entire time and is going to call and check up on you and is going to make sure that everything is there, for you. I think that that's incredibly important. That's probably one of the things I'm most proud of, in working with people, is that I'm able to do that for people. And, it's life-changing for everybody involved, really, to have that kind of closeness, as they find this devastating news, even if it's stage 1, it's devastating news, what do I do next? What does that mean for the rest of my life? What do we do? So that's what happens when it comes back, abnormal. We have a plan in place, and you have people that are going to take care of you.
Yeah. I think I want to emphasize that this is really a differentiator in what people should be looking for. I think people should be interviewing the people who are going to do this legitimately and asking this question. Yeah. What if my testing comes back positive?
Yeah.
Because anywhere you go, you're likely to get that same result. And I think this differentiates, well, really the outcome, how you feel going beyond the result, clear or otherwise. It's just such an important part of it. and I do sort of see this, like, to your point, I think what we're trying to do is raise awareness and demand for this so that it can be democratized. I sort of see what we're doing like Tesla right now. You start out with a very, very, high-end roadster, and hopefully in a few years, everyone's got a Model 3. Right?
Yeah.
We can all get access to an electric vehicle at some point, but somebody has to start.
Yeah.
Somebody has to demonstrate that this is a new way of doing things, demonstrate the system works, and really change people's interface with healthcare.
Yeah.
I think that's the feedback that I'm getting over and over again is I just want somebody to care about me. And they just feel like a number. They're just going through, and when they don't fit the model and they've still got pain after all the procedures, they're out.
Yeah.
Right. And so I think that this level of care is really where people are craving to be, within this model. And we're terming this high performance healthcare, simply because this is what we do for athletes. And we can do this at scale. I think that's the important thing. And as we bring people out of the chronic disease states, then this sort of level of care can be, much more personalized, much more hands-on. And I think it's how everybody wants to do medicine and wants to do healthcare. I expand from medicine. We think about all the other areas, dietitians and physical therapists and trainers and coaches and all these different people that help in the whole person health.
Yeah.
First, as we go beyond medicine. So that was a really, really great breakdown, Heidi, of all of the imaging and all the directions that we can go with that proactive healthcare. You mentioned one right at the end that was the DEXA scan, breaking down body composition, breaking down bone density. For us, these are really leaning into some of our pillars of vitality now, which is the intelligent training side of things, the nutrition, essentially avoiding frailty going into old age, whilst we have the peace of mind that we don't have any of the big disease states. Can you talk to us a bit about what is the DEXA scan? A lot of people won't know what that is.
Yeah. So a DEXA scan is a type of x-ray that we do for individuals. There's two main types of DEXA scan. There's one that insurance covers for individuals over 65 that looks at only bone density, right, at the hips and the low spine. What we really focus on is what we call a body composition DEXA, where you lay on the scanner and it really does scan your whole body, and it measures those three things: bone density, muscle mass, and different types of body fat. And we differentiate between subcutaneous fat and our belly fat, which we call visceral fat, right? So it really is a great way of determining what is your body composition, and what does that put you at risk for, right? What are the things we need to work on? All of those different categories are incredibly important, right? So making sure you have enough muscle mass as we are getting older. Muscle mass is hugely associated with longevity, almost to the you can predict how long someone's going to live based on how much muscle mass they have, right? Secondly, bone density is really key for people. If insurance doesn't start covering it for people until they're 65, but you see signs of it when you're 45, well, that's 20-year gap that you should have been doing something about it. You know what I mean? Do we really truly need to wait for somebody to have osteoporosis before we act on this? Right. It's much, much more effective when we start working on people when they're young, healthy, able to be very proactive about this, and reverse some of that bone density loss. And then visceral fat. Body fat is important as well, but visceral fat is highly, highly connected to a person's risk for diabetes and heart disease, and can be hugely impactful when we try and change someone's diet and exercise plan to reduce their visceral fat. We can actually see direct effects on somebody's cholesterol levels, their blood sugar levels, their fasting insulin levels. All of those things are hugely tied. So DEXA scans are so, so important. And I think honestly should be part of someone's annual physical, at least maybe even more frequent. If you're doing something like if they're working with you, they need to be doing them more frequently. Yeah. But even just for at large, I wish that people did it as just like their annual part of their physical. It's so important.
Yeah. For our our clients who are in our sort of top level program, we would be doing the body composition DEXA quarterly, really tracking their progress, making sure that directionally the lean tissue is trending in the right direction so that we can make sure the program is right, the nutrition's right. This is a real sort of high-end concierge service, but I think to your point, at least having this done annually really helps us monitor that lean tissue, and as well as the bone mass. I'd really love to sort of touch on that. Again, most of the people who are finding us are women in the 60s and 70s who have recently been diagnosed with osteoporosis. These women, almost invariably, small frame, have been taught to eat and exercise to be thin. So they're undernourished, and they've been doing cardio their whole life.
Yeah.
They've been thinking they're very active, they're super fit. They've been thinking they're doing the right things, right? They're trying to be as healthy as they can be. What are some of the factors that go into moving the needle on bone mass? What should people be thinking about, let's say in their 20s, 30s, 40s, so that at 65, we're not really concerned about these high risk factors for fracture?
Yeah. I mean, you are speaking my language, because I'm so passionate about this, because it really is kind of fascinating that there is no type of screening for tests for bone density until you're 65, right? When really it's such an easy, low risk test to do, right? I just told you the radiation is less than a dental x-ray, right? So, the fact that insurance doesn't even cover this, maybe even once when somebody's 50 or something, you know what I mean? 15 years before they actually get a diagnosis of osteoporosis. I think that would be huge. But the things that move the needle the most are, number one, resistance, right? If you're putting strain on the bone is going to respond and become more dense, right? So yeah, cardio exercises are fantastic, but unless you're doing like a lot of, like something like tennis that puts a lot of stress on the hips or something, there's a lot of rapid kind of movements. You have to be doing something that really puts strain on the bone, because bones are living things, right? So the more you put strain on bones, the more they're going to respond. And you mentioned nutrition, right? So if you don't have enough calcium and vitamin D specifically, you cannot build bone, right? So if you're not getting the adequate nutrients that your body needs, it's going to be very, very difficult for your body to create the strong bones for your whole life. And really very slow process, right? So when somebody finds out at 65 that they have very severe osteoporosis, I mean, the chances of them getting back into the normal range are almost zero. You know what I mean? But if somebody is in their 40s or 50s and starts to do these things, we can kind of stop that curve that naturally happens, especially for women, and kind of keep their bone density as high as possible to prevent them from ever getting into those very dangerous osteoporosis ranges. What's interesting about nutrition, it's not just making sure you get enough calcium and vitamin D, but when you look at the nutrition as a whole, we're starting to see how much absorption has to do with what you're eating. If you're eating good, healthy, raw foods, it's very easy for your body to absorb those things. But we see in so many people who are gluten intolerant or eat a lot of processed foods, and we're just finding out that there's so much complexity there with gut absorption that even if you're taking the vitamin D and calcium supplements, your body's not able to absorb and use them correctly if the rest of your diet isn't balanced. So it's more than just taking a supplement. It's like looking at everything you're eating and making sure, and like the quality of the food you're eating, all of that has an impact on how your bone density is over the course of your life.
Yeah, I just think that that's such an important message, that we're so drawn to a pill. Just calories in and out. If you're in a chronic calorie deficit, it's really hard for your body to build any sort of robustness in the tissue, whether it's bone or muscle or skin, hair. All of these things are impacted because you just don't have the energy to create this new tissue.
Yeah.
And I want to emphasize as well that when we're talking about putting strain on these muscles, we're talking about lifting weights.
Yes.
We're not talking about the weights that you can do 30 reps of. you shouldn't be able to lift more than 12 reps, right?
Yeah.
This is weight, like, because if your muscles are producing that much force, they're doing that through their action on the bones. They are pulling on the bones. It's that creates the stimulus in the bone to lay down new bone tissue and become stronger, more robust.
Yeah.
And that takes time, as you said. We need to be lifting weights early in life so that we can watch that bone density get as high as possible before we start seeing it sort of come down the other side, going into sort of perimenopause and menopause.
Yeah.
And then even continuing into midlife and beyond, continuing to lift weights, continuing to stimulate the muscle. That's a message for me that is just so important, because I see, again, a lot of people think they're lifting weights, think they're doing enough because they do yoga. We do a lot of squats in yoga, right? Okay, good. But, we need this stimulus.
Yeah.
Jumping, right?
That's a good start. It's not going to
Right, because you'll adapt to that level of load very quickly.
Yeah.
Right. And I think that progressive overload, where you're lifting weights and now you're doing some jumping, where you're creating big, fast forces and creating a stimulus for things to adapt.
Yeah.
And that takes you into 65 in a really, really good place.
Yeah. And that's why it's really important for someone to work with someone like you, Jeremy, who knows what they're doing and is going to do it in a safe environment. Because if you've never lifted weights and all of a sudden at 65, someone tells you have osteoporosis and you need to start lifting weights and you don't even know where to start, you know what I mean? It's really important to work with somebody who's going to guide you on how to do this and how to do this safely. Because the last thing you want to do is to start a new training program you think you're doing right now, and then you injure yourself because you don't have the right form. You're not doing the exercise that are going to give you the most effectiveness for your effort. Sure. You know what I mean? So I always encourage people, find someone who knows about this and and that you're excited to work with, who's going to, gently encourage you and push you a little bit more than you were going to do probably on your own. Get the right form, then start doing this. And I think it's so important for someone to partner with someone like you who knows exactly how to improve these and it's actually going to move the needle.
Right. Yeah. Well, thank you for that.
Yeah.
Well, and so let's say we get to 65, we get that osteoporosis diagnosis. It's really hard to bring that all the way back. But what hope does that individual have? Like, what should they be doing? Where can they get to? I want to make sure that people understand that it's never too late to be on this path, right?
Yeah. I mean, at some point, I think I usually encourage people, I want to continue to measure things, but it's less of focus on improving your number to an X amount of score, because part of that has to do with genetics, right? So we think that probably 60 to 70% of a person's score on the DEXA scan could be from a genetic factor, right? So it's potentially that we can only move it 20 to 30%. So I don't want people to get too focused on the numbers. Once we diagnose you in the osteoporosis or osteopenia range, you can make a huge difference on improving your risk of falling, which is really the ultimate thing we care about, right? So it's not just about improving those numbers. It's when you get into your 70s, 80s, 90s and beyond, what is your risk of falling? And if you fall, what is your risk of breaking a hip? So when we work with people, again, I think it's so important for them to work with a trainer, because what we're doing is not only building bone, we're building muscle, we're improving their mobility, we're improving their flexibility, their hand grip, all of those things, so that if they fall, if they lose their balance, they're much, much less likely to actually suffer a fracture. So that's what I want to focus on with people, because I think sometimes people get discouraged when they don't see the numbers shooting way back up into the ranges where they want them to be. But I'm I think that this is only measuring one piece of it, right? That the bone density is only one piece of it. Your mobility, your strength, your muscle mass, all of that kind of plays into things. So I hesitate a little bit to give people what their actual improvement of the T-score is. Because sometimes for people, even just stability is a good goal to have, because you're fighting further progression of the loss of bone density. Does that answer your question rather than?
Yeah, absolutely. And it's such a great point, because that's exactly sort of how we view fracture risk, right? And why strength training, and particularly power training, are so important in later years, because we don't just go from standing here and fall over and break our hip, right? It's not like that. You trip, right? And then it's about, when you trip, do you have the power to lift your foot and the speed to get it out in front of you, and the strength in your quads and the power in your quads to stop you and decelerate the body so that you don't fall over?
I love that.
Yeah, so we work on that a lot. We actually work on having people stand on their tiptoes, lean and fall forward and catch. So we train their ability to do it.
Never heard anyone doing that before. That's good.
Oh, yeah. And one of my clients, I was so proud. She's 80 years old. She went to New York, tripped on the street in New York and caught herself. And her daughter turned and goes, well, there's your training. My moment of glory.
Yeah. I mean, that's real world effectiveness.
Yeah.
That's huge. So so I would say those kinds of things, it's much harder to measure that, but that's all part of it. And that's really the goal, is to get you to live as long and healthy as possible. So the measurements really help us risk stratify you and to help us determine what the plan is going to be for you. But all of these things kind of have to come together to help prevent your risk of ever falling and breaking a hip when you're 90,
Right. Exactly right.
That's good.
Yeah. Well, we're coming up on time. We've got so much from this, so many practical things that people can do, so much understanding of how do we navigate this world, as all this messaging starts coming out. So thank you so much for this. Now, where can people find you? Where can people see your work, read more of your content?
Yeah. So the best way is probably through my website, contacting me there. It's www.longevitysb.com, SB for Santa Barbara, longevitysb.com. And on Instagram, I'm also there at Longevity Santa Barbara. You can find me there, but the website is the best way to get a hold of me. I love our conversation. I feel like we could talk all day. We are very like-minded, and it's really nice to kind of hear your perspective, because there's similarities, but we have enough of a different background. I just love it. It's a very conversation. So I really appreciate it. Yeah.
I likewise, I think that it speaks to the value of cognitive diversity, or just diversity for diversity's sake, is that two people can't possibly have the same viewpoint, right? We haven't come up through the same pathways. And so if we all try and tackle the same problem with a slightly different viewpoint, how can it not be better?
Yeah. We work together as a collective, huh?
Yes. Yeah, exactly. It's a good concept.
I love it. I'm so glad. Well, thank you so much for having me. It's been a pleasure.
Yeah. Thanks so much. I really appreciate it. And we'll make sure all of that goes in the show notes. We'll have a summary here, so people can check it out and understand this a little better.
Perfect. All right. Thanks so much.
Thanks, Heidi.
That was an eye-opening conversation with Dr. Heidi Millard on the power of proactive healthcare. Here are the 3 key takeaways from today's episode. Number 1, proactive health screenings are crucial. Don't wait until symptoms appear to start taking action. Technologies like whole-body MRI can detect diseases at their earliest stages when interventions are most effective. Number 2, strength training is essential for longevity. Lifting weights isn't just for athletes. It's one of the most effective ways to maintain bone density, prevent frailty, and improve overall health as you age. Number 3, personalization is key. Your health journey should be tailored to your unique risk factors, goals, and lifestyle. A one-size-fits-all approach simply doesn't work when it comes to longevity. If today's discussion resonated with you and you're looking for ways to integrate early detection, personalized health strategies, and strength-based longevity into your own life, we'd love to help. At Vitality Collective, we've built these principles into a comprehensive system designed to optimize health and performance at any stage of life. If you're ready to take action and see how this approach could work for you, visit us at vitality-collective.com to learn more. Before we leave, just a quick reminder. The information provided in this podcast is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Thanks for listening, and we'll see you next time.